You know, for most of us, we get a toothache and that leads to a dentist appointment, or we go there for preventative care and cleaning.
But what if regular visits were just not an option? Dr. John Krupka's here. He's making sure people in the Dominican Republic can get what they need as part of his service. Good morning.
Good morning.
So you recently took a mission trip to Dominican Republic. Let's start by, we're going to throw up some pictures of what life is like there. Why is it hard for people to get access to dental care?
Well, there's a lot of poverty there, and people just don't have the means to go get dental care because they don't have the money or they can't afford to go get it. And so we go there, and there's a clinic now set up. The first time I was there, we worked out of a hospital, and it wasn't like a hospital here. There were broken windows, things didn't work very well, the chairs didn't move. It was very challenging to work on people, but everybody was grateful. They have a line outside of hundreds of people waiting to get in, and they come back and they wait all day just to get a chance to come in.
And some of the options that you can provide for not only them, but locally, the implants, the dentures. Let's talk through that.
Yes, well, there are several patients that I treated there that we removed their teeth, we placed dental implants, and they got an immediate prosthesis that they could eat with right away. And we do the same thing at my office too, where we treatment plan, we have everything planned out, but at my office everything now is digital. So the workflow, once you come in, we can take the teeth out, we can place the implants with guides, and everything's done that way. And then your prosthesis is also set on that guide and immediately retrofitted to those implants so that you can eat that same night.
It's a lot quicker these days. Yeah, dentures isn't what it used to be, or implants.
No, not at all. It's fantastic now. And well, when we were in the Dominican, it's so rewarding helping these people. They're so grateful and so appreciative.
I am always amazed when I see your commercials on Channel 5 for the laser that you have, that for people who are afraid of needles or very nervous to go to the dentist, you can do these procedures painless and without Novocaine.
Oh yes, it's fantastic. Every day we use it in the office for doing fillings, and the patients, they don't have to be numbed, they don't have to worry about any of that. There's no recovery time afterwards. So when they leave the office, if they want to go eat lunch or breakfast or wherever, they can eat immediately because they're not numb, they don't have to worry about drooling, and the fillings are hard already with the tooth-colored fillings, so they can do whatever they want immediately.
You won't spill coffee down the side of your mouth when you're driving home from the dentist. That's my favorite part.
Do you get reactions from people that say, I wish I wouldn't have waited this long? This is great, life-changing.
Oh, all the time. Like with the laser, people come in because everybody's a little skeptical.
Yeah.
And when they come in, they're like, oh, well, that was fantastic. I don't know what I was worried about.
Is everybody a candidate for the laser? Can you use it on pretty much every patient?
We can use it on pretty much every patient. Everybody's a candidate for it. The laser is also used for soft tissue, so we regularly help people out with tongue ties, like if they have speech issues with kids. There's virtually no recovery time at all. It's just like a little pizza burn.
Very interesting. Well, you can learn more about Krupka Dental. They are serving the Valley on Crooks Street in Kaukauna.
Give them a call at 766-1122 or check out more information at krupkadental.com. Thank you so much for being here this morning, Doctor.
Well, thank you for having me.
Absolutely.